As you just heard in the news, the first 5 healthcare workers to be vaccinated against COVID-19 in Ontario 21 days ago received their second dose of the vaccine today. But there is growing concern that we're behind. Biostatistician Ryan Imgrund, who we've had on the show, says when it comes to the number of individuals vaccinated per 100,000 people, we are dead last amongst all of the provinces, and he calls it extremely frustrating. Joining us right now for a local perspective on what's going on, epidemiologist Dr. Raywat Deonandan. Welcome back.
Thank you.
Happy New Year.
Happy New Year to you as well.
Good to get you on the show. So how do you think we're doing with the vaccine rollout as it stands right now?
No, I don't think it's great. I'm a little frustrated as well. I would think this would be the number one public health priority in the history of public health priorities in recent history. And yet we have vaccines still in warehouses as far as I know. Like, I could be wrong about that. And anything we have should be in people's arms, anything that's not being reserved for the second dose. So it's a little frustrating, especially since we had a couple of days off during the holidays when vaccinations weren't occurring. This should be a 24/7 endeavor, and I'm not entirely sure why it isn't.
What's the issue here? What do you think the issue is?
I asked that on Twitter. What is the rate-limiting step? Some people claim it is the insufficiency of healthcare workers because they're overworked, absolutely. However, we have a battalion of family doctors putting up their hands saying, we volunteer to do this if you need us, because they understand that this is a priority. And also, family doctors are well positioned to be able to give education for patients and to understand side effects and things like that. So we should be using these resources. I think it might just be, I hate to put it, but a little bit of lack of imagination. I'm told that the Pfizer dose, because of its deep cold chain aspects, needs to be kept in the hospitals, and so we're relying upon hospitals to disperse it. And if that's the case, then these are centralized areas that don't have a lot of experience with community-based distribution of assets. And local public health people are trying to overcome that centralization, trying to get deeper into where people live. So I guess some of this is growing pains. Like, I'm trying to be generous here and give people the benefit of the doubt. And maybe as the Moderna shots arrive, some of these barriers will have been worked out so we can get this out faster.
So when they say it is going to get better, we're going to get more doses, things will start to speed up in January, your reaction is, I hope? You're right?
I think that actually, I'm a stupid optimist. I always say that. But I think it will get better for a couple of reasons. One is people are angry. 2 is I think we've seen the barriers and we can overcome them. 3 is the new Moderna shots don't have the same cold chain issues that the Pfizer shots have, so they can go faster and deeper and further. And we're having more vaccines coming online. Possibly the Janssen shot, possibly the AstraZeneca shot will be okayed soon. And definitely globally, manufacturing is ramping up fast. So we may get a flood of doses coming our way soon, in which case the issue isn't supply anymore. The issue is still demand, but it's also dealing with that supply as it arrives. So that's what I hope happens soon.
In Quebec, they've canceled some appointments for the second dose of the COVID vaccine from Pfizer because they're delaying the second dose in order to inoculate as many people as possible with the first dose. What do you think?
This is not something that I like. Now, I understand the desire not to reserve a second dose. I'm not a fan of that either, but I get it if you're confident about your cold chain, your supply chain. If you can get enough stuff in those 21 to 28 days so that people get the second dose on time. But if we're saying we're okay with delaying the second dose indefinitely, I'm not comfortable with that. For the very reason that the clinical trials do not give us enough information to tell us what happens if we delay that second dose. Now, there will come a time, maybe, possibly in some places of the world, where that is a viable strategy because the crisis is so intense. For example, the UK is doing this with the AstraZeneca shot because they're sitting on a plague of unbelievable proportions. I don't think we are there yet. I think we should be sticking to the protocols, but I'm not the one making these decisions.
So there are more than 3,000 new COVID-19 cases in the province. The majority are still in Toronto and Peel. But in Ottawa, things are climbing. Where you and I are, we have 104 new cases and 1 new death. The case count isn't that high. But then, of course, there is the positivity rate, which is now 4.2%. And you'll remember around Christmas, it was around 2.5%. Unsurprisingly, the levels of COVID in the water seem to have been correspondingly going up over the last 2 weeks. I've got a clip here of U of Ottawa Associate Professor Robert De La Tolla, who says that they are watching this closely.
So they've been increasing for the past month. About a month ago, they started to slowly incline. We started to see them go up. And in the last 2 weeks, they started to increase a little bit faster than that. The levels are still under than what we were seeing in October as compared to what you were mentioning about the daily cases. But they are increasing. So there is a little bit of a warning there that as these numbers increase, that maybe we should try to curb our activities and try to mitigate this trend that we're seeing right now.
What did the latest local numbers say to you?
Well, we're still in the non-crisis stage. However, the reproduction number is above 1. We are increasing. We are obviously have more cases. The wastewater analysis is deeply troubling. And the test positivity rate, of course, is an issue. Now, you and I had talked about several weeks ago, what is the trend for Ottawa? And my position back then is we're probably heading in a bad place. And I stick with that prediction, not because we've done anything wrong. It's just because the nature of the epidemic is just so fierce at the moment. And the test positivity rate, remember, that's essentially 2 indicators built into one. On the one hand, it tells us if we are testing enough. And on the other hand, it tells us, is the disease finding deep penetration into the community? And on both sides, I think we're probably seeing more serious cases make it to the testing centers. So we're having a slightly higher number of cases coming back positive. But more troubling is the probability that, in fact, we're having deeper penetration of the disease. And the wastewater does bear that out. So we're into the bad time of the year, as was predicted. The next few weeks, if not 1 or 2 months, are going to be the worst of the pandemic, quite probably. So we have to buckle in. And I think the best solution, of course, minimize our contacts, but also get the vaccine out as quickly as we can.
Are the higher numbers and the higher positivity rate the result of the holidays or of the new variant or both? What's your sense?
Yes, I mean, I really have no idea. I want to say it's the result of the holidays. That seems to be the logical conclusion. But the variant might be playing a role, and it might be here in larger numbers than we thought. Now, the genomic surveillance data is not yet available, and that's being done across the province right now. A certain percentage of positive tests are being further investigated to see if they, in fact, are the new variant. If that's the case, if it proves to be like more than, say, 10 or 15%, then that might be driving it. I think there's some suspicion that's happening in some parts of the country, but again, there's no data to confirm that. We could look at some of the epi curves to get a strong sense of what that might be. In the UK, for example, the curve has a couple of humps, which strongly suggests that the new variant showing up is driving this new explosion of cases there. I'd be surprised if it's so prevalent in Ottawa right now that that's what's driving most of this. But at the very least, it doesn't change what we have to do. We have to minimize our contacts and just stay away from places we don't need to go to. And possibly keep schools closed longer. I think that's what's going to happen.
When I asked Dr. Etches last week about the lockdown, she had previously said maybe we could just do a 2-week lockdown. She said, no, I've changed my mind on that. We need the full 28 days now. And I said, possibly longer. She said, let's wait and see. Let's look at the numbers. What do you think?
I think it will be longer, to be honest. It's looking pretty... we can't say for sure. I can't tell the future. But if I were to make a prediction based upon the trend right now, I would say we're in this for longer. Because we have yet to see the effects of the Christmas holidays really manifest in the data. We've had, quote-unquote, lockdown for 2, 3, 4 days now. And we've had a increased amount of human contact for a couple of weeks before that. So the next couple of weeks, we should see the peak of that behavior manifesting in the data stream and a longer time to come down from that peak. So it's going to take effort, restrictions, and so forth to drive those cases down further. I wouldn't be surprised if this wave is continuing well into the spring. So we have to take pretty extreme steps to force it down by the end of February.
Dr. Raywat Deonandan, thank you very much.
Thank you.